conference on COVID-19. Before I give the floor to Dr. Tedros, just to remind everyone that this is the second time now that we have a simultaneous interpretation into 6 UN languages. We would like to thank our interpreters who are with us here in their cabins and who will be helping interpret questions that hopefully will come from all over the world. We have tried to promote this new interpretation that we have, so hopefully we will get more journalists from all over the world. I will remind everyone, please, to be short in their questions so we can take as many as possible. I understand that we may have a Portuguese as of Friday, but we will confirm that as well. We have sent you a number of press releases from different WHO offices in the regions, but also in countries. Hopefully that gives you some information about what WHO is doing around the world. Today, Dr. Tedros, Dr. Maria Van Kerkhove, and Dr. Mike Ryan are here with us to answer your questions, but I will give the floor first to Dr. Tedros.
Hello, everyone. Globally, almost 2.5 million cases of COVID-19 have now been reported to WHO, and more than 160,000 deaths. Trends in different regions, and even within regions. Most of the epidemics in Western Europe appear to be stable. Although numbers are low, we see worrying upward trends in Africa, Central and South America, and Eastern Europe. Most countries are still in the early stages of their epidemics, and some that were affected early in the pandemic are now starting to see resurgence in cases. Make no mistake, way to go. This virus will be with us for a long time. There is no question that stay-at-home physical distancing measures have successfully suppressed transmission in many countries. But this virus remains dangerous. Early evidence suggests most of the world's population remains susceptible. That means epidemics can reignite. One of the greatest dangers we face now is complacency. People in countries with stay-at-home orders are understandably frustrated with being confined to their homes for weeks on end. People understandably want to get on with their lives because their lives and livelihoods are at stake. That's what WHO wants to, and that's what we're working for all day, every day. But the world will not and cannot go back to the way. There must be a new normal, a world that's healthier, safer, and better prepared. The same public health have been advocating since the beginning of the pandemic must remain the backbone of the response in all countries. Every case, isolate every case, test every case, care for every case, and quarantine every contact, and educate, engage, and empower your people. This cannot be effective. The fight cannot be effective without empowering our people and without full participation of people. Countries that do not do the 6 central things and do them consistently will see more cases and more lives will be lost. WHO's advice is to find and test every suspected case, not every person in a population. WHO is committed to supporting all countries to save lives. And we're also committed to human rights and to fighting stigma and discrimination wherever we see it. There are disturbing reports in many countries in all regions about discrimination related to COVID-19. Stigma and discrimination are